the Finance Committee. And with that, we are recording. A reminder that we are recording today's meeting for minute-taking purposes, but also in alignment with our processes and procedures. And the recording will be made available on the Access Health Agency website after the meeting. I'll remind folks who are in this meeting that if you are not a voting member of the board, please keep your mic on mute as we try to work through the presentations. There is a point of opportunity for the public to comment in our public comment, which is on the agenda. And with that, I would like to ask for a roll call just to establish the quorum for today's meeting and attendance.
Chair Claudio Gualtieri.
Here.
DPH Commissioner Manisha Tutani.
Here.
Thomas McNeil. Matthew Brackman. DSS Commissioner Andrea Barton-Reeves.
Here.
Thank you. We do have a quorum, Mr. Chair.
Great, thank you, Claudio, again. And I'll just remind folks too, as we try to follow the conversation, both for those people who are joining us as guests and listening to today's board meeting, and those that may be listening to the recording, and for our note-taking purposes, if you could reintroduce yourself when you speak, it helps follow the conversation and make clear who we're attributing different comments to in our minutes. So with that, we'll move to our meeting agenda, and the second item for business is public comment. I was informed that we had no formal written advance comments by anyone, but I'll pause to see if anyone joining us here today would like to raise their hand for recognition in our public comment phase. Seeing none, I think we'll move to the next item of the agenda, which is a review and approval of our last meeting minutes. I will ask for a motion. I imagine that folks had a chance to review those minutes in advance that were sent out. So if I could ask for a motion to approve our last meeting minutes from April 13th, 2023.
Motion to approve.
Okay, the motion is moved. Do I have a second?
Second.
Moved and seconded. Any discussion on the meeting minutes? Seeing none, we'll take a roll call to approve the minutes.
Claudio Gualtieri.
Yes.
Matthew Brackman. Thomas McNeil. Andrea Barton-Reeves.
Yes.
And Manisha Tutani. Dr. Tutani.
Oh, sorry. Yes.
Thank you. Oh, Mr. McNeil has joined us. Is that correct?
Yes.
Mr. McNeil. Okay. Are you voting in favor of the minutes? What's your vote,
yes.
sir? Okay. Thank you. Motion passed.
Great, thank you. So ordered then. So the next item for business is a proposed review of our operating budget. For this, I'd like to turn to James Michel, our CEO, and Sanisha, Head of Financial Planning and Analysis, to introduce our FY 2024 proposed operating budget and take questions from the committee members.
James, you're on mute.
James, you're on
James,
mute.
I think you're muted.
Thank you. My apologies. Good morning, all, and thank you, Mr. Chairman. Today's discussion is going to be about our FY 2024 budget. It's kind of, before Sanisha gets into the details, I just want to give an overview of where we are. Our proposed budget for this year, for the next fiscal year, rather, is a reduction of $734,000, and most of that is because we are reducing the amount of money we spend on big technology updates. We do have increases in other parts of the budget, but there's a net decrease for that purpose. And we are also asking the Finance Committee to consider an increase to the assessment that we charge the industry, particularly small group and dental and individual premiums. This is how we fund our operations of 0.20 percentage increase to the assessment. Right now, the assessment is 1.65%. We are proposing going to 1.85. We will still be the lowest in the country. And again, it's not a apples to apples match compared to other exchanges. A lot of other exchanges do not have all the expenses that we have because they are supported by state operations, state budgets, and we are fully funded by our own assessment. We get zero support from the budget from the state. So with that said, so we get into the details of the operating budget now. I believe a copy of the slide was sent to every member of the committee. I'm going to ask Tanisha to get into it. And now, as you have any questions, please interrupt us, stop us whenever we need to provide any clarity for the committee. And Tanisha.
Thank you, James. Sinisha Tsurunkovich, Head of Financial Planning and Analysis. And Marcin, could you go to the next slide? Thank you. So
Sorry,
first off,
it's really, can I just interrupt for a moment? I'm having a hard time hearing you. I know if you need to be closer to the laptop because it's sort of hard to hear you.
might be the VPN. Is it any better now or?
That's much better. Thank you.
Okay, sorry about that. So first of all, we'll talk about the fiscal year 2024 proposed budget. And the first slide here, you'll see, like James mentioned, the $734,000 reduction in the fiscal year 2024 proposed budget compared to fiscal year 23 adopted budget. Now I'll go into a little bit more detail on the next slide. Is everyone still hearing me?
Yes.
Yes, we can hear you
Okay.
much better now.
Okay, I just noticed a couple of people scrambled, so I just want to make sure you guys are hearing me. Okay, good. So this is a more of a detailed slide on the proposed budget for fiscal year 2024. Here we continue applying for grants, and we set a goal to get at least $100,000 in grants next fiscal year. We're not going to be using reserve funding like we did in the past year to fund our budget. The interest rate has stayed put, and we believe we're still going to generate interest income. And in the past year, like I said, not using the reserve, the other revenue line goes away except for the rebate revenue, which we generate by paying our vendors. There is a marketplace assessment decrease prior to any changes to our assessment rate. There is a decrease of $577,000. And that is mainly due to the small business moving to self-funding options. And that's one of the biggest reasons why we're asking for an increase. So the last line on the revenue side here, you'll see the proposed assessment increase of 0.2%, which would generate $1.85 million on a fiscal year basis. I do want to mention that this will still be the lowest assessment among the state-based exchanges in the country. On the expense side, the employee costs have gone up because we have hired some contractors instead of paying through contracts, which is actually helping us because we can get more out of, we can get better employees and less as well. So on top of that, there are the salary increases of 3%, which are merit-based, so not everyone gets 3%. The fringe benefits have increased as well. There's a 7.5% increase in medical insurance and retirement plans and other benefits. Temporary staffing as well, that cost has gone up because the cost of hiring staff has gone up. The equipment and maintenance has increased because we are still in a transition period for the enterprise operating model vendor, where we're still in that transition in the coming up fiscal year from Deloitte to Infosys, and as well as other maintenance costs have increased the last couple of years. And as you will see under the IT enhancements, we don't plan any large IT development projects, although we are still doing some system updates. I'll stop here if anybody has any questions. Okay, we can move on to the next slide, Marcin. Thank you.
I apologize. I actually did have a question on the previous slide. If that's okay.
Oh, go ahead.
All right.
Go ahead.
Yes, I wanted to ask a question about the no large IT development projects. I wondered, so does the budget include an opportunity for us to work out some of the kinks that we've been discussing about covered CT? Right? We were talking about some of the challenges that either the current system or the website has toward getting in getting more people enrolled in covered CT. And I know that some of those were IT challenges, some of those were outreach challenges, but in cutting back on this number, does that preclude us from continuing the work that's being done to make that part of the site more navigable and accessible?
Commissioner Reeves, we have a meeting this afternoon to go over the planning, and this budget will not stop us from moving forward with that specific focus.
Okay,
All right. So
Thank
yes,
you.
we are fine. And again, I think you'll be pleased with the plan. I think we forwarded the deck to the group. So no, this does not impact that at all. Our ability to
Okay.
do that as well.
Thank you. That was my only question. And yes, I was aware that that was happening, but
And by
thank
the
you.
way, the plan is to get that money to come out of reserves
Okay,
to pay for
all
that.
right.
All right.
Thank
But we'll
you.
get into that. Thank you.
All right.
Archie, you can go to the next slide. Thank you. So this slide represents the DSS shared cost of the budget. There is no change to the DSS shared cost piece of the budget compared to the last fiscal year. And we have confirmed that with the DSS staff, the finance folks.
Just kind of put this in context. You see the largest part of this is operations, and that's mainly the call center for the most part. The call center, printing, scanning, and those are the three biggest part of the operational costs. And call center is probably about $13 million for DSS, about between $12 and $13 million. The balance is for scanning and printing and mailing.
Thank you, James.
Yeah, just one question here for point of clarification. I see that it seems to be a reduction in temp staffing and an increase for the exact same amount for maintenance and development. Is this in line with the previous statement that you said where we're looking to shift temporary staffing and bring on actual employees? Is that what you've done with the 174,000 and change shift between those line items?
That is slightly different on this because a lot of the temporary staffing there is the IT staffing, and is sometimes there is a shift where you could get, instead of having the staff, you might be able to do a maintenance contract. So it's just a shift from that perspective.
Yeah, Claudia. Most of this work is done collaboratively between us and DSS, and most of them sit either at the DSS site or at the state IT organization. And they do a lot of testing, they do a lot of work, and sometimes their work shift between staffing and contracting, depending on who's best positioned to do it. So this does not, we're not moving any of the temporary staffing to actual staffing. This is all work between us and DSS. Earlier, with dedicated staff that do work strictly for Access Health.
Okay, that's helpful. Thanks,
I hope
James.
that's okay.
Next slide, please. And I will talk about the assessment and the impact of the assessment increase. Next slide, please.
Excellency, before you go very quickly, Mr. Chairman and committee members, my apologies for not introducing Julie Andrews. Julie Andrews is from Wickley Consulting, and she was a big part of the evolution of the assessment numbers that you are about to see. And she's here. She's part of this presentation. So, or if you have any questions specifically about assessment, she's ready to give you the context about how about the calculations, especially the ones in the future. I'm sorry, Sinisha, go ahead.
Thank you, James. So you'll see a couple of charts here, and our assessment revenue has been declining over the last 4 years, while the expenses simultaneously have been increasing and are projected to outpace the revenue by about $4.3 million in 2026. And Marcin, if you can move on to the next slide. There's more content on this. So how are we addressing this assessment revenue shortfall? We for fiscal year 2024, there's a gap of $2.6 million between assessment and expenses. And this gap will be covered by a combination of grants, interest income, rebate revenue, and the proposed assessment increase of 0.2% or 20 basis points. So what we would do is propose an assessment increase starting on January 1st, 2024, which will bring $3.7 million on a calendar year basis of additional assessment revenue, which, as some of you might be aware, we are on a fiscal year basis. So on a calendar year basis, we'll bring in 3.7, but for our fiscal year 24, that would be only half of that we can use in fiscal year 24, which is $1.85 million. So if you look at the FY24 column in this chart here, you'll see the prior to increase, the assessment is 30.8 million. And then there's the grants, interest income, rebate revenue, and finally the proposed increase of 1.85, which brings us in line to our total expenses of 33.6 million.
This is Claudio again, just for clarifying, it's 1.8 million increase in FY24 because it's only reflecting half 6 months of that assessed increase. So at an annualized level, I just want to make sure that we're clear. It's about a 3.8, 3.9 annualized increase in support through the new proposed fee assessment, correct?
Yes, Mr.
Yes.
Chairman.
Thank you.
Move on to the next slide, please. And just a little bit context on why our revenues are declining and operating costs are increasing. So the revenues are mainly declining due to the shrinking fully insured small group market, which is caused by small employers moving to self-funded products, and this has been going on for years now. At the same time, the expenses are increasing. We continuously have new requirements by Centers of Medicare and Medicaid Services, the state of Connecticut, and Internal Revenue Services. Some of those examples are the security demands, the digital environment keep changing, and the costs are increasing. Some of the state and legislative requirements, for example, last year we took an additional cost for the opioid claims database, which is continued to be in our budget, and we are implementing system changes, operationalizing new state of Connecticut changes such as the Covered Connecticut and Medicaid Unwind programs. Next slide, please.
The one thing I wanted to that this is in addition to our regular, I just have normal operating increases, and so such as salaries as well as benefits. So and those are extras above and beyond what all of us who manages a organization or budget, and every year your expenses go up organically, namely salaries, benefits, rent, other costs, insurance. But those are extra items, and we think over the last 5 years, every year we have new requirements from CMS. The last couple of years from state of Connecticut and the IRS. So we know those are going to become part of our regular annual budget. We just don't know what the numbers are going to be on a year-to-year basis, and we anticipate Connecticut as they continue to look for ways to improve access to health insurance to all of its citizens, and we think that we're going to continue to be a vehicle for that to happen. So, and then we look forward to those to the opportunities to continue to do that as well.
Thank you for the additional comments, James. Appreciate that. How have we been addressing these fiscal challenges? I just wanted to note a couple points here that to meet these declining revenues, additional demands on our budget, we have in the last few years lowered our operational cost by 10% and created efficiencies. In addition, we utilized $1.2 million in reserves for IT projects and initiatives, and then also an additional $2.7 million in the current fiscal year for the Medicaid unwind. We have received as well grants to the tune of $122,000 in current fiscal year to fund our Broker Academy program. We continue applying for grants. Next slide, please. So, just to just to add a little bit more color to that assessment increase. So, I think we already talked about the calendar year and the fiscal year being July 1st to June 30th, which will bring us $1.85 million for help us fund a gap in the budget. When we start the assessment increase on January 1st, 2020, this will fund all the programs like AHCT, help us address the declining revenues and rising costs. Next slide, please. So we have done some research to look at where are other exchanges, other state-based marketplaces. One thing to remind you all that Access Health has not raised the assessment rate over the last 8 years. And as you'll see on this chart, raising the assessment rate from 1.65 to 1.85 will still result in the lowest rate in the country among the state-based exchanges.
Finish one quick comment. The FFE, the federally facilitated exchanges, I believe their rate may go down to 2.25 in the next fiscal year, but this is their current assessment right now. And again, I would just want to reiterate something I said earlier, that we're not comparing apples to apples here, because the Access Health Connecticut, we pay for every expense that we have, where the other exchanges, while they have higher assessment rates, but they're not paying for all of the expenses. A lot of them are in state buildings where they pay no rent. A lot of them are part of certain state agencies where they don't have any general liability insurance, and the state absorbs that. So as a result of that, even though their assessment is higher than us, but their cost structure is a lot lower than ours. Just going to put that in context for the committee.
Thank you, James. Next slide, please.
Yeah, so let's let Julie talk to this particular slide, because just going to put it in context for the committee. Julie?
All right, yes, thank you, James. So as part of the analysis, we wanted to understand how the consumers might be impacted by a change in the assessment. And so the assessment will be applied in the rate development as a percentage increase. And using 2023 premiums and a census that we had used in the consumer impact study, we determined that on average, the increase will be about $1.44 per month for individual consumers. And in the individual market, you know, that will vary by metal tier, with the average being $1.44. With that increase impacting the second lowest cost silver, which is the determination or the metric where tax credits are defined, for those individuals, we'll be seeing on average a small reduction of about 4 cents for the change in the assessment. And at this time, based on the census, about 86% of QHP enrollees are currently receiving tax credits.
So we want to be sure that the committee, and we'll share the same information with the board next Thursday. Then again, while the increase on the gross level is going to about $1.44 per month on average, but because of the APTC increase benefit, most of our customers will see a reduction in their monthly premium, 4 cents on average, because the additional credit that they will receive as a result of the increase to their premium. It sounds a little bit counterintuitive, but the benefit, this could actually help reduce premiums for our customers, net premiums for our customers, for most of them. And the ones who do not get any subsidy at all, they will absorb the entire $1.44, and again, that's about 14% of our customers. The majority of them will see a reduction, and some more, some lower than others, but on average about 4 cents.
Thanks, Mr. CEO. If I can just ask a couple questions on this slide. So one, it's my understanding that this is modeled off of the Inflation Reduction Act extension of some subsidies that were originally in place through ARPA, and that those subsidies are now secure for at least the next 2.5 years through the end of December 2025. Am I right in that understanding?
That is correct.
Great, thank you. And then to get at James' point is worst case scenario, someone who's not getting subsidized at all through any tax credits, the highest impact that we would expect to see is $1.44 on a per month basis. But that for a majority, a bulk lion's share of the individuals on the exchange, those which avail themselves of advanced premium tax credits, they would likely see something far less negligible, if not a small decrease. That's correct. The last point I just want to understand is because we've seen some growth in the bronze plan markets. Any sense to believe that a consumer in a bronze plan will have a materially much different than the 4 cents, like a small negligible amount of increase, but nothing significant, right?
Right. In fact, they would have probably more than a 4 cent decrease, just because their tax credit is tied off of the silver plan, and because it's the change in the assessment is applied on a percentage basis, the percentage impact on their smaller premium will be offset by the larger change to the second lowest cost silver plan.
Okay, very helpful. I really much appreciate the analysis that went into this, because I think our job is as board members to balance obviously the health and interests of managing a highly functioning exchange and making sure it has the resources, but never losing sight of the core mission, which is impact on cost and are the consumers of the exchange well served. And this slide for me is providing some really compelling information, and I appreciate the analysis and thoughtfulness that went into developing it.
On to the next slide, please. The last board meeting, we talked about the reserve fund balance. Just want to give an update on that. So,
Tanisha, if I can ask you to kind of come closer again
little
to the
closer,
computer,
yeah.
we're losing your voice.
okay, is that better now?
Yes.
Okay, good, thank you. So yeah, last board meeting, there were some questions around the reserve and reserve balance. So just to give you an update, the projected reserve balance at the end of the fiscal year 24 is at $19.2 million, which represents 6.8 months of operating funding. And I will, on the next slide, I'll talk a little bit more about the reserve. So we have actually done some research over the last month or since the last meeting on where are other state-based exchanges as far as reserves go, as well as public or quasi-public agencies. And below research shows that of the organizations that do have reserves, they maintain a minimum of 6 months of operating reserve. Obviously, a lot of the agencies don't have any, but based on our experience and the research that we have done, our recommendation is to maintain an operating reserve at about 9 to 12 months. Are there any questions here?
Mr. Chairman, at the end of the last board meeting, the chair of the board and along with several members of the board asked us to look at where our reserves are and where should they be. And so we've done the research. We've looked at all the exchanges, and currently, and only about 3 of them had published reserves. The others, again, we went through all of the financials. The others did not have any published reserves, or they had reserves, but sometimes the reserves were restricted reserves. When the reserves were committed for future expenditures, so they weren't available for anything other than projects that were already committed. And when we looked at the other quasi within the state of Connecticut, a similar story. Again, we looked at the financials, those that have publicly available financials, and many of them had reserves, but many reserves were committed for future projects. So very few of them had any unrestricted reserves, like we do. As Tanisha indicated, based on our analysis and based on our needs going forward, we think an appropriate level of reserves for us for access would be a range of between 9 to 12 months.
This is Claudio again. One, I want to say I think it's important and worthwhile exercise for the exchange to look at what's the right amount for reserves. Anytime we come up with, unexpected costs like the unwind and we're drawing on reserves, we want to make sure that we're doing so in a way that doesn't harm the mission or the long-term viability of the exchange. So it's an important request. I know that the board members all shared this, that we need to be strategic over what's the right amount that we should be keeping in reserves. Also, so that we're not just building up reserves to no end that's not helping make our operations more efficient or delivering on the mission or the consumer experience. So finding that balance is critically important. And I appreciate here that I'm seeing the beginnings of that work and that you being responsive. This is something that came as a request of the board to you, James, and to other in leadership of us really wanting to dig in and get some data on this. And I appreciate that in a short period of time, you were able to do a review of what's publicly available for the state-based exchanges and put some information up here. I would ask that while this is good, important context for the piece of information and the votes that we have to take today in terms of our budget and the immediacy, I would welcome more conversation and a deeper dive. And maybe there's a lot of not applicable information here. So I see some gaps or some unknowns. I certainly, as a board member, would feel a lot more comfortable if we think about maybe other nonprofits in Connecticut that we could also benchmark to that maybe have publicly available reserves, just so that we're more clear before putting on a fine cap on a recommendation for an exact month threshold. But definitely appreciate the due diligence and the beginnings of this work. If others, I don't know if others want to make comment, but I'd like to do a little bit more digging and make it a conversation that we engage the full board in, and maybe look to benchmark against a few other entities as well.
Yes. Commissioner Reeves?
Yes, thank you. So I agree, but I also wonder what the definition of reserve is for each of these organizations too, and perhaps we should think about what our own definition is. Like for some organizations, reserve is being able to run at the absolute bare minimum for a certain period of time, and for others, reserve is we continue with our full operation for a longer or a shorter period of time. And so I would also look to see Mr. CEO, what your thoughts are about what reserves really means, and how you think we should move forward. And should we have a certain amount of reserves to run a full operation for a specific period of time and a more scaled down operation over a longer period of time? Because I think that's important too, as we set the idea of what reserves really means, because we may be able to implement different plans depending on what the circumstances are.
So, thank you, Commissioner. Mr. Chairman, we discussed this at length, and again, the work that we do, as we shared with the chair, is critical to the people of Connecticut. We are the point of entry for access to Medicaid. So even if QHP went away, ACA went away, we are the point of entry for Medicaid. So we think that it's critical that we are able to function completely, and if anything happened. So that's why we are proposing a 9 to 12 month reserve in place. Within 9 months, if something were to blow up where no money was coming in, we think 9 months at a minimum would give us enough chance to catch our breath and get back on track as we continue to provide services to the people of Connecticut. In 12 months, we think that you get an additional 3 months to kind of work out any kinks after that. So we think 9 to 12 months is a very reasonable value in terms of keeping operations going. And if we had to scale it down, we'd work with the board to scale it down. But from our perspective, we are looking at right now we are doing what we need to do to get things done for Connecticut residents and also our partners, mainly DSS. So if we have to scale it down, then that means that people in Connecticut would not have access to health insurance. That's why we think that keeping things going as we do now, at a minimum, is what we would need to continue. So we think 9 to 12 months is inappropriate. And to your point, Commissioner Reeves, while we did the analysis, every organization are very unique unto themselves, meaning that we know what our needs are. Again, just kind of the benchmark is California, Colorado, DC. We just want to see exactly what they're doing, where they are. But at the end of the day, I have to work with the board, the finance committee. What can we afford, and also what are our needs? Again, we'll go back, Claudio, and look at other nonprofits and see where they are. But again, a lot of these organizations we're looking at in front of us right now, again, we're not comparing apples to apples. A lot of them don't have expenses that we do have, because they may be in a state building. They may be part of a state agency that's paying a good chunk of the operational costs, or shared with other state agencies. A lot of the costs are absorbed by the state, and it's mainly insurance. Cyber insurance is climbing every year. It's jumping 10 to 50%. A lot of the agencies don't have cyber insurance needs because the state is covering them through their own insurance or their own self-insurance programs. Again, everything we do, we are paying out of the assessments. So that's why we came with the 9 to 12 month reserves. But we will go back and do a little bit more analysis, looking at other nonprofits to see how close we are. And to the extent that we can, we'll see what the logic is for these nonprofits, again, to see how close we are with our own logic. So, Mr. Chairman, would you like us to not share this information with the board at next Thursday's meeting?
Oh, no, I didn't want to take that point at all. I think it's a
Oh.
good first start, and I think
Okay.
this is sort of like the draft where we could now co-create, and I would look for the board to provide strategic advice, just like Commissioner Barton Reeves did here today, where that was an excellent point of unpacking the definition and the assumptions in what's contained in a reserve. And to your point of understanding that not all these exchanges have the same financial obligations or commitments in terms of what other supports besides reserves. If they're attached, for example, to a state agency and have that as a backstop, that's a different position to be in than a standalone nonprofit or a quasi-public that is dependent solely on the stream of revenue from the assessment. So I think this is such a strategic opportunity for us as a board to work with leadership. I don't want to just short circuit it with the analysis that's here, which is a good first start, but I do want to invite more analysis, thoughts, feedback.
So we will add the caveat that this is a work in progress. This is our first step. This is a work in progress. As this evolve, we'll work with the finance committee, then ultimately to the board, with the board.
I see Mr. McNeil has his hand up.
Yes, I was go ahead.
Yeah,
Thomas
just a
McNeil.
question. I know we've tapped into the reserves a couple of times. Where do we stand now in terms of carrying? How many months can we go with what the reserves are?
Right
presently?
now we're at 6.8, almost 7 months of reserves.
Oh, okay.
And we think if we decide to go with the 9 to 12 month range, within 2 or 3 years in just efficiency, cost cutting, and potential surpluses, we could get to that 9-month threshold within the next 2 to 3 years.
I got you. Okay.
I'm sorry, I was gonna say that that was the last slide of the presentation. Thank you.
Thank you, Claudio, again. So that brings us to, I don't see any hands raised for any more discussion. I think we had questions throughout, and it was a really robust conversation. I appreciate the discussion, the details, and the back and forth on the proposed operating budget. With that, our next item would be to entertain a motion to approve the FY 2024 proposed operating budget as just presented here by the exchange staff. Do I have such motion?
I move that we adopt the FY 2024 operating budget as presented.
Thank you.
I second it.
Moved and seconded. Any further discussion on the motion? Seeing none, I'll ask for a roll call on the motion to approve the FY 2024 proposed operating budget as presented by the exchange staff.
Claudio Gualtieri,
Yes.
Matthew Brockman, Thomas McNeil,
Yes.
Andrea Barton Reeves,
Yes.
and Manisha Tutani.
Yes.
Thank you.
Great. So the next complementary vote, as we just approved a budget that anticipated a fee assessment increase, and it was necessary to balance the budget. This is the complementary that the Finance Committee will now need to take up and make a recommendation to approve to the board the exchange market assessment rate of 185 basis points. So I'll entertain a motion to do so now.
So moved.
I second it.
Okay, motion is moved and seconded. The motion is to recommend for approval by the board for the calendar year 2024, the exchange market assessment rate of 185 basis points. Any discussion or questions? Seeing none, we'll move to a roll call.
Claudio Gualtieri,
Yes.
Matthew Brackman, Thomas McNeil,
Yes.
Andrea Barton Reeves,
Yes.
and Manish Jutani.
Yes.
Thank you.
Okay, that concludes our formal business
So-
and brings us to the last motion, which is simply a motion for a meeting adjournment. And before we do, I'll remind you that you can see here that November 9th is our next scheduled meeting, and I hope to see you all then. In the meantime, we have a full board meeting next week and some internal conversations that were discussed or referenced earlier today. So I know there'll be a lot more Access Health for us to engage with over the next few weeks. And so I'll entertain a motion now for adjournment.
So moved.
I second it.
Moved and seconded. I think we take a roll call now for the official to adjourn and close the meeting.
Claudio Gualtieri,
Yes.
Matthew Brackman, Thomas McNeil,
Yes.
Andrea Barton Reeves,
Yes.
and Manish Jutani.
Yes.
Thank you.
Mr. Chairman
day,
and committee
everyone.
members, thank you very much.
Thank you.
Thank you all.
Thank you.
Thank
Okay.
you.
Bye.
Take care. Bye.